Hello, my name is Cristobal Reyes, joined by Taryn Paris, Akila Jackson, Janice Flores, Francis Parentella, and Scal Steinkamp. And today, we'll be talking to you about coccidioidomycosis, better known as valley fever. So what is valley fever? Valley fever is another name for a fungal infection called coccidioidomycosis. It's caused by inhaling the spores of a fungus called coccidioides. The fungus grows in soil, and once that soil gets disturbed, the wind may carry that soil along with the spores of the fungus, making it possible to be potentially inhaled. 97% of valley fever cases in America occur in areas of Arizona and California. It's becoming more common in California specifically, with incidences increasing 213% from 2014 to 2018. Some signs and symptoms. So valley fever is a self-limiting illness. Once you are infected, you are more likely to develop flu-like symptoms. These symptoms can include fever, fatigue, chest pain, chills, and cough, and death may occur in some severe cases. However,
where is valley fever most prevalent? The areas most prevalent to have the fungus coccidioides living in their soil is in the southwest of the United States, parts of Mexico, and Central and South America. Valley fever derives its name from its discovery here in the San Joaquin Valley of California. How are people infected with valley fever? The most common way for someone to get infected by valley fever is by inhaling coccidioides spores. They circulate into the air by soil being disturbed by humans, animals, or weather. Once inhaled, the lungs can be filled with these spores that can reproduce more, which cause pneumonia, amongst other issues in the body.
Though anyone can get valley fever, those who disrupt the soil while at work are of greatest risk, including farmers, field workers, construction workers, and miners.
Diagnosis of valley fever is a combination of signs and symptoms, as well as blood tests and sometimes a sputum culture. Biopsy can be used, but that is more of an invasive way of diagnosing valley fever. Signs and symptoms of valley fever are like many other illnesses, but some are specific to valley fever, such as uncontrolled crying and joint pain. Rest and antifungal medications are the only prescribed treatments for valley fever. In addition to that, good nutrition and staying hydrated will also help your body fight off the infection.
Although the prognosis is generally favorable for most patients, it is important to explain to them some of the rare but possible complications. Continued follow-up is central to the management of uncomplicated coccidioidal infection, and the interval between medical visits varies according to the seriousness of the symptoms and course of infection. On this slide, it will show that the Valley Center for Excellence of the University of Arizona outlined a suggested plan for follow-up visit shown on the slide. And as you can see, it runs until at least 12 months.
Avoiding areas with high amounts of dirt, such as construction sites, can help prevent people from becoming infected with valley fever. If a person works around dirt, then they can protect themselves by wearing an N95 respirator mask.
Local services for treatment of valley fever are available in our San Joaquin County Public Health Services and San Joaquin County Human Services Agency.
Out here. That is windy. Hi, guys. Hey, guys. Hello. We have a booth that we would like to invite you to see working so hard out here in the sun.
Oh, what kind of booth? It's about, we're going to be showing you what valley fever is all about. It's deadly in this area.
Oh. Why don't you guys come over? We got water, like she said, and a canopy with some shade. You guys can take a break. We can talk to you guys about valley fever.
That sounds good.
I can use a break.
Yeah, all right.
Come on, let's go. Here's the water.
water we promised you guys.
Thank you.
And we have some pamphlets.
How's your day?
Oh, we're working so hard out there. It's hot.
Oh, I think.
I'll
Thank
take
you
one.
for the water.
There you go. There's pamphlets about valley fever, like we discussed earlier.
Yeah, so do you guys know about valley fever at
No,
all?
I've never heard of it.
Okay, well, it's a fungus that grows in the soil, and you can get it in this area that we live in because it's very prominent. As you see on the map, a lot of southern and mid California, as well as down into Mexico more, a lot of farmlands have this fungus in the soil. And people that are predisposed to it are those that are farmers that work with a lot of soil, and it can be let up in the air and you can inhale it.
Oh, I had no idea.
Yeah. So some symptoms you might feel are cough,
Fever, you'll get like a rash, you'll have some eye pain, back pain. A lot of times along with that eye pain, you'll get some eye watering, like almost uncontrolled crying.
Almost
Can
like
be a-
flu symptoms.
Yes, almost like
Oh.
flu symptoms. But then you're gonna have joint pain and muscle aches and
you may have chest pain also. So if you have any of these symptoms, being that you are farmers and you work in the soil a lot, we would love for you to go in and see your doctor right away to go to the nearest emergency.
Well, we work on the farm every day, so how do we prevent it?
you can prevent it by wearing an N95 mask, just like in this picture right here.
While we work?
Yes.
Oh.
And for your family and friends who do not work around soil, the best way for them to avoid getting it is by staying away from areas like construction sites, farmland, if they don't need to be around it. If there's a windstorm, they can go in the house, make sure their doors are closed. If they're driving, roll the windows up.
But it's not communicable, right?
No.
I was just about to ask that.
Yeah.
So if I have valley fever, I can't give it to my friend?
No.
No.
It's airborne only, so you breathe it in.
From the soil, and it gets into your lungs, and that's when it causes all those symptoms. And they can test this in the ER by doing a sputum test. Sometimes they may order a chest x-ray,
Blood work,
blood work.
check for antibodies.
And then how is it treated?
If there's no symptoms at all, don't think that you're already cured. It takes after the symptoms has been diagnosed, you need to wait 6 months to at least a year to continue your treatment and checkups. So follow-up checkup is very important.
And what happens if we don't get it treated?
It can develop into worsening things like pneumonia, and you'll have to take some antibiotics. But originally, if you take the antifungal medication as prescribed, it can help relieve the fungal infection.
Okay.
And rest is a huge part of treatment.
Well, thank you very much for informing us.
And if you need some more information or some more leaflets, you can go to the San Joaquin County Public Health Services and the California Department of Human and Health Services.
Thank you
And
so much.
those leaflets would be very helpful.
Well, thank you for the waters and thank you for all the great
Yes.
information.
You're welcome.
Knowledge check.